It is a great honor to be able to speak here. Today, I would like to talk about this. I have no financial COI. With the high aging era, a growing number of very elderly patients have been cared for during their end of life at home. Most of these patients are in the advanced stage of complex diseases, including dementia. But it is difficult to predict the cause of death in all cases before it occurs. This slide shows the causes of death by age in Japan. According to Japanese Ministry of Health, Labor, and Welfare, heart disease is one of the leading causes of death for very elderly subjects aged 85 and over. And these ratios are around 16 to 20% for both men and women. Further, inadequate emergency transportation has been a problem for these cases. Although Japanese population has been declining, the number of emergency transports continue to increase, especially in high-aged individuals. The purpose of this study was to determine the frequency of acute cardiovascular events in causes of death in end-stage very elderly patients during home-based palliative care. We retrospectively investigated the predicted causes of death and the actual causes of death in this subject during April 2017 to November 2019 from their medical records. Simple inclusion criteria of this study is that subject is over 75 years and after sufficient informed and consent of end-of-life care at home. We also investigated the frequency of acute CV events in cause of death and this diagnostic accuracy, and also investigated the frequency of emergency medical system use at the time of death. The study results are as follows. Characteristics of the study subject are shown here. Over a period of 32 months, 220 patients died and 33 patients excluded from the study protocol. Finally, 187 patients were included in the study. The mean age was 89 years and the percentage of female patients was 53. Coexisting conditions including dementia, active cancer, heart failure, and COPD are shown in the slide. Dementia highly coexisted in these study subjects, and most of them were advanced stage equivalent in stage 7. 41 patients, 22% of total subjects died of unpredictable causes. Of these, 20 patients, 11% of total subjects died of acute CV event, including 15 cases of sudden cardiac death, 3 cases of aortic aneurysm rupture, and 2 cases of acute aortic dissection. The other 21 cases died of infectious diseases or severe gastrointestinal colorectal bleeding, and so on. The accuracy of causes of death in acute CV event-related deaths also investigated. Aortic aneurysm rupture and acute aortic dissection cases were identified by computed tomography or ultrasound scanning at the time of death or after death. And one of sudden cardiac death cases was identified cardiac rupture due to acute coronary syndrome by computed tomography scanning after death. The other 14 cases diagnosed as sudden cardiac death were not identified with these exact diagnoses. Only 19 patients, 11% of total subjects, used emergency medical system at the time of death. Emergency transportation rate was higher in non-cancer cases, but all unknown sudden cardiac death cases were not included. The summary of this study's results are shown here. In end-stage elderly patients during home-based palliative care, 22% of the study subjects died of unpredictable causes. Of these, almost half of them were acute CV deaths. Further, 17% of acute CV death cases were unknown causes of sudden cardiac death. To put it simply, unknown causes of sudden death. Contrary to expectations, only 11% used emergency medical system at the time of death, but all unknown sudden cardiac death cases were not included. Acute CV diseases were not rare causes of death, even in the end-stage very elderly patients during home-based palliative care. But over three-quarter cases of acute CV deaths in the study subject were unknown sudden cardiac deaths. According to Japanese mortality statistics, heart disease is one of the leading causes of death for very elderly subjects. However, the details of heart disease were not mentioned in the statistics. So it is difficult to predict the prognosis of patients with complex chronic diseases, including advanced stage of dementia. And sometimes end of life comes suddenly and unexpectedly. In such cases, it is difficult to diagnose whether such situation has caused a new event or is a natural cause of underlying diseases. This may depend more on subjective opinion of the attending physician than on the objective evidence in many cases. In conclusion, this study added on the new point this topic that the prevalence of CV event-related deaths may be overestimated in such subject. Thank you for your attention.